we have only about 150 calls that come in per day into that facility, and a small portion of them are during that hour. So even if we staffed it to complete 100% in shift C, we're not certain in the amount of work they'll need or not need. Now, all that being said, as indicated in the presentation, Medicare is advancing the program to complex chronic people. And what that means is that right now, the government is allocating around 20 to 30 minutes per person per month. In the complex chronic care billing, there's no limit. And so we may find ourselves actually being able to spend more time with people later in the day, trying to coordinate what sometimes can be more than 10 complex chronic diseases. So I'm not really sure if that's going to impact how we look at utilization rates across shifts or the density that we need to literally man the phones and talk to people. But we've seen it historically be that shifts A and B make up about 80% of any given calendar day. All that being said, it kind of just averages out to about 200, maybe plus or minus 10, but anything wildly beyond that requires new space.
So how frequently are you hiring now, and do you have open positions currently?
We do. We're constantly in a state of hiring. So what that really means is that we find people that are that love the job better than others, meaning that they perform at a level that is consistent with the clinical quality that's important. And so the system in and of itself has a level of attrition from people just not feeling that this is something that is a good match for them. But otherwise, we have continued to grow, thank goodness, in the amount of people that we need. So we always have new jobs to fill that are new, and then we have some portion of jobs of people that have left CareSync that we need to backfill. So we're always hiring.
Travis, I received a resume from an RN that's moving here. Who should I give that to?
Linda Daigle is our head of recruiting. She more times than not works out of the Wauchula campus, and so she's down there now. But just even at HR@caresync.com, we just make special.
Are you looking for RNs?
Very much so. The way that we staff our teams is that we kind of like our RNs are like lieutenants level platoon. They kind of provide the leadership at sort of an officer level in the sense that they have more clinical experience. They require more rigorous training than sort of some of the other ranks, if you will, like LPN, MA, in CNA and CMS. So each team has at least one lieutenant on it, and for us that would mean an RN. So always looking for good RNs.
Travis, whenever you're saying 200 to 300 jobs, now you're talking Wauchula.
Yes, sir.
Are your recruiters working hard in Hardy County?
Yes, sir.
How hard a time are y'all having getting people from Hardy County?
On a scale of 1 to 10, I'd probably say it's somewhere around a 6 or 7. I mean, we have a better chance of, a bulk of our hires still come for people that have the right attitude and we train for skill to the Tech River or CareSync University program. That's been relatively easy. That's a 2 or 3. Finding some of the LPNs and RNs, though, that are here has been a little bit more difficult. That decreased when we expand our search radius to the attached counties along the Hardy border. That helped, but still, I think that it's one of those things just in general with healthcare is that you have to be able to tell the story as to what the job is. And I think that that's one of the reasons why we're really focusing on branding in many of the things that we do. And so the signage and other things to create a brand. So, wherever you might live, you want to work at CareSync. We don't allow people to work from home. And so you have to find a campus that you would gravitate to. So one of the things that we're trying to do is to continue to present a brand here in Wauchula that attracts those that have advanced nursing skills to repurpose them in a way that they're doing telenursing, for lack of a better term. I think it will always probably be a challenge to do it because there's 2 things. One, we have a density issue to work off of, but we also have a new line of nursing, right? So when you think about telenursing through chronic care, we're really the largest and the first. So we're having to wait for the industry to sort of catch up with this being a new line of nursing opportunity as a profession. So I think that it'll get easier over time, but I don't foresee at least a way that we get past 300 unless we really start to create a rigorous training program that creates CNAs and CMAs in a way where it's training them in just large classes, right? Right now we got classes every other Tuesday, Wednesday, Thursday, so they're 3 days long, 4 days long for the nurses. Those are happening twice a month. We would have to have a more robust program at the feeder level that actually, hire people at 50 at a time, recognizing that probably 25 to 35 actually graduate, and then 30 of them actually want to keep the job and keep the job for at least a year. So you're always sort of working off the funnel. Candidly, we have been in a position over the last 18 months where we're really doing kind of just-in-time hiring, meaning that we've not really got to a point where we can sort of think 6 months in advance, figure out how we fill that funnel, and then bring those people into a way, because candidly, it's expensive. So remember, one of the things that our employees have is they have full benefits, like everything. You imagine dental, life, short-term, long-term disabilities, all these sort of benefits. So when we bring on a person, we need to be certain that they're at least ready to work 30 days after hire. So we can't hire too many people because that costs too much money before we actually put them into the system. And we can't put them into the system any faster than they're ready, because then they end up, basically, we are the virtual nursing arm of practices. And so there's just a balance and a science that we're still trying to figure out. What is the amount of people that you recruit and train to then give you some known number of people that end up doing well and performing in their job, the 3 and 6, 9 and 12 month mark. So I don't know that I have all the answers, but I think in terms of at least the meetings that I've had with recruiters and HRs, the 250 to 300 number is at least a safe amount of math over the next 12 to 18 months.
Do y'all do CMA training there?
Yes.
Do y'all charge employees or?
No, we don't. We actually pay for it all. So you actually, it's part of the training cost, right? And so we go through the interviewing and recruitment process. Then when you hire, you immediately start training with us. And so if you all new care sinkers, as we call them, get Tuesday, Wednesday training. So everybody goes to the same orientation, whether you're CNA without a license yet or you're a vice president, everybody goes to the same training. It's then the Thursday, Friday on to the next weeks if you want to be a CNA. So they will be in training for several weeks before they ever get to the point where they are ever, on the line and actually talking to patients. So those costs are pretty significant. And so we try to manage that use of our investment capital as wisely as we can, so we don't overhire in the sense then that we might not have the amount of patients that they need to see that otherwise grow bored. And so it's just kind of a just-in-time scenario.
Any other questions or comments from the board? So, Travis, you mentioned the sign unveiling. Can you tell us a little bit about what you're planning and what you would like us to do? I know that you'd ask if we would be present at the sign unveiling. I think we'd all like to see, kind of a milestone event.